secretary to call the roll, please.
Bryan,
Here.
Parker, Barnett, Blackwell, Blunt, DeBar, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins.
Thank you. The first matter before us today is the confirmation of Benny Hubbard to the State Board of Health. Mr. Hubbard's been nice to come and visit with us. Mr. Hubbard, if you can figure out how to get the microphone to work, I think you punt that button and the light will eventually turn green. And then if you're very careful and speak right directly into the microphone, potentially we'll be able to hear you. But we'd just like for you to tell us a little bit about yourself, your background, how it's been on the time you've been serving on the board and where you see things going and whether you plan to keep on the state health officer for another month.
Thank you for having me. I appreciate it. My entire career, professional career, has been in the healthcare industry. I moved to McGee when I was a junior in high school in '73 and started working in a drugstore then. Had a lot of friends that had physician friend, that parents were physicians, and healthcare just began to interest me. So I went to the University of Mississippi Medical Center and finished with a degree in nuclear medicine technology, and I practiced that for about 4 years. Then I got into the nuclear pharmacy business for a number of years. Did that. We were based out of Chatsworth, California, providing unit dose radiopharmaceuticals, and it was very new when I started working with them. At some point in my career, I was the administrator of the first psychiatric residential treatment facility in the state of Mississippi for adolescents, children and adolescents, which was Mill Creek, based in McGee. Later on, we started a consulting firm for the healthcare industry and did consulting work. My business partner's a healthcare CPA, let me add that. And we did consulting work for many sectors in healthcare. And at the end of the day, and if you would have asked me this question when I first started in the healthcare business, I'd have never dreamt it. But we ended up being in the long-term care industry, and we have skilled nursing facilities in 3 states and some other healthcare. We vertically integrated in some areas like therapy, institutional pharmacy, and those sorts of things. So my time on the State Board of Health has been minimal. I do think that, and I've dealt with the State Board of Health for many years with licensure and certification and radiologic health. But my few months experience on the State Board of Health has been eye-opening. I will say that I think that Dr. Edney, being our state health officer, with his experience that he had in the private sector, running his own medical clinics, et cetera, I think he's bringing some of those business strategies into the department that's helping streamline some things. He has expressed to us his desire to be very customer service oriented for those that the State Board of Health, or that the State Health Department serves. So I think that we were during the COVID times, we were very involved with different departments within the Board of Health. And there was some disorganization, I have to admit, but I think that Dr. Edney is working very hard to organize things better, to restructure the department so that we can provide better services for the people of Mississippi.
Do any members of the committee have specific questions or comments? Senator Blackwell.
Thank you, Mr. Chairman. I just say, I don't have a question, but I have known Mr. Hubbard for a good number of years. I think his business acumen would serve those folks well on the Board of Health. So,
I'll say Dr. Hubbard, and looking at, Mr. Hubbard, it's the second time. He started this, it's not my fault.
I'll answer to anything.
I'm reminded of Franklin Roosevelt putting Joe Kennedy in charge of the Securities and Exchange Committee. And that Joe Kennedy was very much familiar with the way that Wall Street worked, and they needed someone on the SEC who knew that. So I think your background in public health will be very useful on the Board of Health because you do know how things work and know how things work from a different perspective. I think it's good that we've got a nursing home owner on the Board of Health in addition to your other thing. I don't know that we need 11, but the reason you have an 11-member board is to get different people with different perspectives. And just from my point of view, I think you bring a perspective to the board that will be very helpful. I will just say that one of the almost obsessions that I have, and I think the Board of Health and Department are doing this anyway, is to have somebody look comprehensively at healthcare all over the state in every aspect. And we spend an awful lot of money on healthcare at the Department of Corrections, by way of example. I'm not sure that money's spent most effectively. I'm not sure we're getting is the quality of care that we would need. But separate and apart from those issues, there are doctors and hospitals and folks on the ground all around all these facilities. Surely there's some way that the spending on healthcare there can be used to help maintain those facilities that we desperately need, many of them in rural areas. And I'm not sure that the Department of Corrections has that as the #1 item on their agenda. And I mean, there are other examples of that. So I know that the department's doing that. I think that's one of the most important things that can be done long-term for the state. Just one more example and I'll stop. Obviously, the state health plan, more or less, says we need a hospital in Greenwood. Like everybody agrees we need a hospital in Greenwood. And 10 years ago, we had a hospital in Greenwood. But as the world changed and things started changing, we woke up one day and had left just the shell of a hospital. Whose responsibility was it to prevent that from happening? Well, nobody's. And so those are the sorts of things that I would like for the State Board of Health to look at comprehensively. It's a big burden, but Dr. Edney assures me he's got plenty of spare time, but you can do this. Is there a motion? There's a motion that we do advise and consent. Is there further discussion? I forgot to ask, Dr. Hubbard, is there things you'd like to tell us that you think we need to?
Good.
Okay, all in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. We appreciate your driving up to visit with us. It's helpful for you and it's helpful for us. And as you know, it's a mighty important board. Thank you for being willing to serve.
Thank you.
We have 3 other items on the agenda. I think the facility, the information is being distributed. Senate nominations 12, 13, and 95, which are nominations to the Board of Dental Examiners. I'll give members an opportunity to look at the peer committee information. If you've not already, the peer committee found one person that was involved in a lawsuit about a car wreck, but other than that, nothing of consequence, I think. So if there's no objection, I'd be inclined to take those up in a block, and I would entertain a motion that we do advise and consent. Without objection, we will consider these in a block. There's a motion, we do advise and consent. Comments, questions? Not, all in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. What's the further pleasure of the committee? Oh, there's a motion to rise and report. All in favor? All opposed? Ayes have it. Thank you.